Hi guys, in today's video I'm going to be discussing how you will know if you have diabetes or not. If you have not watched my first video on all you need to know about diabetes, where I describe type 1 and type 2 diabetes, the signs and symptoms and the causes, please go to my page. Don't forget to follow, like, comment and share to your loved ones, because you may never know who will need this video. There are 4 basic tests that an individual needs to do in order to determine if they are diabetic or not. The first one is what we call HbA1c. This HbA1c test is carried out over the period of 2 to 3 months in order to determine if one is diabetic or not. A HbA1c of below 5.7% is normal. A HbA1c that is 5.7% and above up to 6.4% means the individual is pre-diabetic. What do I mean by pre-diabetic? Pre-diabetic means the individual blood level is not normal, but at the same time it's not high enough to be diagnosed with type 2 diabetes. Now, if the HbA1c is 6.5 and above percentage, then that means the individual is diabetic. Now, how often can one run this test? This test can be run every 3 months for someone who is already diagnosed of diabetes and is on management. Then it can be run for every 6 months for an individual whose blood glucose level is stable, in order to know when you are pre-diabetic and to act fast. The second test is what we call fasting blood sugar. Now, this fasting blood sugar, before an individual does this, you need to be fasting for at least 6 hours. Don't eat anything. Then the blood is taken, and then the sugar is run. The blood glucose level is checked. Now, a blood glucose level of 99 milligram per dl is normal. A blood for fasting blood sugar. Then a blood glucose level of 100 to 125 milligram per dl means the individual is pre-diabetic and need to act fast. Then a blood glucose level of higher than 125 milligram per dl means the individual is diabetic. Now let's move to the next one, which is glucose tolerance test. This test is very common for pregnant women. Every pregnant woman is being prescribed this test, glucose tolerance test, to do it, because that's what we call gestational diabetes, which is developed during pregnancy. That's why they normally recommend this test, this glucose tolerance test, for every pregnant woman, in order to know if they have gestational diabetes, for people that are not diabetic before they got pregnant. And how is this test done? The individual needs to fast for at least 6 hours before the time to start the test. And when you go for this test, you are going to first of all check your fasting blood sugar level, and then you are going to be given a very concentrated glucose drink to take. Now, what does this test do? They are trying to know how your body manages the glucose, regulate the glucose level. Now, glucose tolerance test, then when you're given the drink, they will give you a period of 2 hours. Blood is taken after 2 hours and 3 hours in order to check the glucose level. Then at 2 hours, if the blood glucose level is 140 milligram per dl or below, that means it's normal. If it is between 140 milligram dl to 199 milligram per dl, that means the individual has pre-diabetes, is on their way to being diabetic, so I need to act fast. Now, if after 2 hours the blood glucose level is 200 milligram per dl and above, that means the individual is diabetic and need to go under treatment. Now, the last but not the least blood test is the random blood sugar test. This random blood sugar test it can be done at any time, whether you have eaten, but you need to eat something at least. That's why they call it random. not for a fasting person. If you're fasting, then it's going to be fasting blood sugar. Random blood sugar test is just for someone that have eaten, and maybe you're sick, you just come to the hospital and they need to do your blood sugar and you've already eaten. So they're going to calculate your test or your result based on random blood tests. If that blood sugar that is 200 milligram per dl and high above, it means that the individual is diabetic. But if it is below 200 milligram per dl, it means you are not diabetic. But also, you need to do the HbA1c. Please, I recommend everyone to go and do this test. You can do it in the hospital, you can do it in any diagnostic center. Please, everyone needs to do this HbA1c test in order to determine if they are diabetic or not and act fast. Thank you for watching, and please don't forget to like, comment, and share to your loved one and friends. You might never know who needs this video. Thank you. Bye. See you in my next video.